Med-Surg chapters are about 50 pages long, and half of the time you can tell what is important. Before we get into the details, I always like to zoom out first to look at the big picture of the chapter. I use a concept map like these to break it down heavy chapters. So we have Unit 7. Unit 7, promoting health in patients with hematological disorders, so the blood disorders. And in this video we have chapter 33 from Davis, assessment of hematological function. So it's assessment, and each unit they talk either about blood or other functions, and then they have coordinating care for patient with whatever that chapter is. So in this unit it's about blood, so we have assessment, and then the next chapter will be coordinating care. That's it, it's on this unit about blood. And since we are in chapter 33, this is the concept map that I always say, and if you take a short screen of this picture, you kind of know what is going on in this chapter. It's very quick, and it's repeated from anatomy and physiology and everything we know about blood. But this book likes to kind of overview of the blood. So at first the chapter talks about introduction, an overview about blood, then it's getting overview of anatomy and physiology and overview of it of hematology function. So this is kind of getting in one category, but I separate. And then assessment and diagnosis studies. So as you see, this chapter it's 4 basically. So the introduction and the anatomy and physiology of blood and how blood is function, and what nursing intervention and assessment and diagnostic that a nurse should know about blood. So the hematological system is composed of the blood cells, lymph, and organs involved with blood function or blood storage. The blood is the transport medium for oxygen, nutrients, and other substances in the body. So the chapter 33, it's all about how we evaluate blood function by looking at red blood cells, white blood cells, platelets, and coagulation times. It covers various blood tests and bone marrow biopsies, which are crucial for diagnostic blood disorders, infection, and even some cancers. The chapters also details the nursing action involved before, during, and after those procedures, as well as potential complications like bleeding and infection. Then we will break down the keys of this chapter so we can really master it. So the learning plan is first blood components and their normal ranges, coagulation studies, bone marrow, aspiration, biopsy. So we go on the next slide.
Hematologic system performs 3 crucial functions: oxygen transport, hemostasis, and host defense.
So now we are an overview of anatomy and physiology. So let's do a quick introduction before I go in more details. So the chapter 33 focus on the comprehensive assessment of hematological function, and it's essential for identifying blood-related disorders, which will be more in detail in the next chapter. The hematological system includes like blood components, the red blood cells, white blood cells, platelets. He's talking about the bone marrow, the site of hematopoiesis. So this is more like nursing knowledge about pathophysiology of how blood is created, and it's good for nurse to know about it. And English is not going to tell you like, oh, let's talk about this. This is more like nursing knowledge, advanced knowledge. Then the lymphatic organs, we have spleen, the lymph nodes, the thymus, and the liver, which produces clotting factor. A well-rounded understanding of those components is crucial in identifying disease patterns such as anemia, very important, and clotting disorders, very important, leukemia, and infection, right? So in the following slides, I'm gonna talk about the bone marrow, the blood cells, the red and white cells, then the plasma and spleen. Here if you see how the blood vessel is, so how I like this picture because you can see so pretty, good looking the red blood cells and the white, how it's divided, and the plasma, the platelets, and here how the white cells, it's all in molecules. I think it's very nice, this picture. I just put it so this hematological system, as we know, it's made by blood, and then the primary is to function, it's to oxygen transport. So we know that the normal blood, a normal adult blood volume is about 5 liters, right? So plasma and form elements. So we know that the lifespan of red blood cells is about 120 days. Platelets, it's 7 to 10 days, and most of the white blood cells, usually it's hours to days. So we go next to the bone marrow. So here it's actually pathophysiology, how the early stage and the late stage. And usually in classroom, they like to ask about one of those components. They ask you true or false, either it's in early stage or late stage. So this it's really nice to see and to understand the red cell, how it's uh, made. So this is the pathway of how red blood cells are formed. So the primary function, we always know that the red blood cells is to transport oxygen to the cells. So what they do, the aspiration in the bone marrow may be necessary to provide additional information about blood formation. So we know the red blood cells, it's 120 days. So that's the lifespan. So you see hematopoietic. So it's kind of hard to remember those steps, especially if they in the quiz they ask you to write it down. I hope not. I'll be better to be true or false. Okay, so go more in detail about the bone marrow on the next slide. Yeah, I like those pictures. If you like the pictures, you see here the bone marrow, and we were talking about hematopoietic stem cell. So what do we know about the bone marrow? This guy here. What do we know about him? So it's the red marrow produces pluripotent stems that they say in the book, the myeloid and lymphoid lineage. So the yellow marrow, so we have the red and yellow. So the yellow marrow adipose can revert to red in severe anemia. And stroma, so the reticular cell fibroblast provides growth factor like interleukins. So more in detail, so here is the erythrocytes, and here it's the other ones, the lymphoid, the TB, and the neutral killer cell here gets the plasma. So bone marrow, so this hematopoietic tissue, they call it also bone marrow, located within the long, long and flat bones, and it's responsible for metapoiesis. Yeah, the formation of all blood cells. It contains pluripotent stem cells that differentiate into myeloid and lymphoid lineage. As you see, I'm taking my light away just to kind of see better without my light. The myeloid red blood cells, platelets, neutrophils, eosinophils, you can see there, basophils, monocyte, and lymphoid B cells, T cells, and the neutral killer cells. So the bone marrow biopsies are diagnostic for leukemias, lymphomas, and marrow failure, like example aplastic anemia. We talk more in the next chapter. So the diagnostic note, bone marrow biopsies are used to diagnose conditions like I said, the leukemias, lymphomas, and aplastic anemia. So back again to hematopoiesis occurs in the bone marrow again, and is regulated by growth factors and hormones such as erythropoietin, which stimulates the red blood cells production. And as we know, the red blood cells production requires iron, folic acid, and vitamin B12. Disorders in these areas can lead to various types of anemia. So the leukopoiesis, the white blood cells production, and the thrombopoiesis, hematopoiesis, which is the platelets production, are also crucial process supported by the stem cell. And the age related is very important. Later in the book, maybe I can talk later about the age related changes from the end of this chapter. Explained about while the bone marrow ages, it produces fewer blood cells, so that's why. But let's talk about this more at the end, which will be better to be here since we talk about age related changes for this bone marrow. So here we like to see the difference between granular and not granular. The little guys are granular. I just like pictures. So the primary function of white blood cells is to fight infection, to destroy foreign matter, and eliminate damage of abnormal cell in the body. That's why we have this here. The white blood cells are integral part of the immune system and are necessary for functioning. So look at leukocytes, white blood cells. They call it WBC, are key defenders against infection and part of the immune response. So the categories, the granulocytes, which is the neutrophils, bacterial defense, eosinophils, the allergies, the parasites, and baso, it's histamine release. The without granular, agranular, so the lymphocytes, the B and T cells, and the monocytes. The monocytes which become macrophages. And for instance, leukopenia, it has low blood, the white blood cells, which increase the infection risk. And leukocytosis, it's high in the blood, on white blood cells, which indicates infection, inflammation, and leukemia. So everything that is low blood cells, about pnea, has a suffix at the end, pnea. And for the high, either doses or poly. Poly is like for more, but that is for the red, not the white. Here we have the blood consists of plasma and form elements. This is form elements. 45%, which includes erythrocytes, leukocytes, and thrombocytes. Plasma. Plasma contains water, electrolytes, nutrients, and proteins such as albumin, globulin, and fibrogen. Each form element has specific roles. Red blood cells transport oxygen, white blood cells protect against pathogens, and platelets play a role crucial in homeostasis. And again, I repeat that hematopoiesis occurs in the bone marrow and is regulated by growth factors and hormones such as erythropoietin stimulates red blood cells production. So the red blood production requires iron, folic acid, and vitamin B12. Disorders in those areas can lead to various types of anemia. And thrombopoiesis, the platelet production, are also crucial process supported by the stem cell. Here we have a better good looking to see what I just said earlier. Again, blood composition. Blood is vital connective tissue that supports oxygen, transport, immune response, clotting, and nutrient delivery. And it's composed of plasma, which is 55%, the liquid portion that is about 90% water and carries protein, electrolytes, hormones, nutrients, and waste products. Then form elements, we have 45% includes erythrocytes, the red blood cells, leukocytes, the white blood cells, and the thrombocytes, the platelets. Again, the erythrocytes, the red blood cells right here, they have the exact normal value, which is nice. Here I like this picture a lot. Take my light away. So the red blood cells, as we know they're biconcave cells that transport oxygen from the lungs to the tissue via hemoglobin. They're also assist in carbon dioxide removal produced in the bone marrow through the erythropoiesis that we saw earlier, early stage, late stage. They live approximately 120 days. So if a person have low red blood cells, it's anemia. So symptoms, it's fatigue, pallor, and short of breath. If it's too much red blood cells, it's polycythemia, causes thickening the blood and increased clot risk. Here the clinical note of the red blood cells counts results in anemia, while high it's in the poly, causing the thick blood increased clot risk. Then we have the leukocytes, the white blood cells. We have the values here. They are the key defenders against infection and part of the immune response. Plasma, the liquid matrix. Plasma is the yellowish fluid part of the blood that remains after removing blood cells. Its key components include the albumin, maintains oncotic pressure and transports hormones, drugs, and electrolytes. Then the globulin, you see it's 30%, includes the antibodies, the immunoglobulins, essential for immune function. The fibrogen, inactive clotting factor, convert to fibrin during coagulation. The thrombocytes, the platelets are cell fragments essential for initiating blood clots formation. They aggregate at site of vessel injury to form a plug and release chemical that triggers the clotting cascade, they say. Here they talk about the thrombocytopenia. I said earlier, penia means low. So here we have the low platelets, risk for bleeding. The thrombocytosis, the ptosis, it's high, so it's the platelets risk for clot formation. So if it's too much platelets, it's risk for clot formation. If it's too low, then it's risk for bleeding. The platelets are and clotting factors work together in this process of blood clotting and the control of bleeding. And the lymphatic system also is involved in the immune response. The clotting cascade maintains the homeostasis through a complex interaction of intrinsic and extrinsic pathway, culminating in fibrin clot formation. So here it played the role of PT and INR diagnostic in the blood, which are used to assess for extrinsic pathway. For instance, for warfarin therapy, while PTT evaluates the intrinsic pathway for heparin therapy. The platelets also contributes to clot formation by forming a plug at the injury site. The spleen, and they're talking about function of the spleen. So the spleen we know is the white pulp, the lymphoid tissue, immune surveillance, and the red pulp filtrates age red blood cells and storage platelets. So it's like about a third body supplies. Here we know about the splenectomy, which increase risk of encapsulated bacterial infection. So the lymphatic organs, immune support, spleen, filters blood to remove old red blood cells, stores platelets, and contributes to immune defense. And we know the lymph nodes is the house immune cells and filter lymph to detect pathways. The thymus, the site where the T cells maturization, most active during childhood. The liver clotting factor production. Probably we should talk on the next slide where we talk more about overview of hematology function. Here the function of blood system. We were talking about bone marrow, the hematopoietic tissue, the bone marrow located within log and flat bones, which are responsible for hematopoiesis, the formation of blood cells. It contains these pluripotent stem cells that differentiate into myeloid and lymphoid lineage. So the myeloid, the red blood cells, platelets, neutrophils, eosinophils, basophils, monocytes, and the lymphoid, the B cells, T cells, and neutral killer cells. Bone marrow biopsies are diagnosed for leukemias, lymphomas, and marrow failure. We were talking about plastic anemia. And here we have more about how the clotting uh, uh, factor and the oxygen delivery. So how the oxygen is transport. So the hemoglobin saturation and red blood cells mass determine oxygen carrying capacity. The hypoxia stimulates renal erythropoietin, which increase erythropoiesis. Then we have the clotting cascade, the hemostasis, the vascular spam, platelet plug coagulation. Then we have the interesting contact and intrinsic tissue factor pathways which converse to activate factor X. X actually it's 10, and the prothrombin 2, then into thrombin, then in fibrinogen to fibrin. So this is in liver actually. Liver plays a special clotting factor production. So the liver synthesize most of clotting factors, the 1, 2, 5, 7, 9, 10, 11, and 12. And when they write in Roman letters, those numbers. And the proteins like albumin. So liver dysfunction impairs coagulation and protein balance, leading to bleeding and risk and edema. Impaired coagulation, it's increased bleeding risk, protein imbalance, right? And then potential for edema due to low albumin level. And the book also talks about antithrombin, the 3 protein, and fibrinolysis, which is the TPA, limit the clot size. Then we have the host defense, which is the inflammation and immunity. Here the neutrophils and macrophages perform phagocytosis, and eosinophils modulate histamine. The B lymphocytes into the plasma cells, which is antibody production. T lymphocytes, they talk about CD4, number 4, and CD number 8, which coordinate cellular immunity. Took a short screen from the previous concept map, and we can just follow the pathway. And a very detailed patient history and physical exam are very vital. The key questions involve like from fatigue, recent infection, bleeding, bruising, diet, medication use, and family history. Physical signs include like pallor, jaundice, petechiae, also lymphopen. Oh my goodness, that word, lymphadenopathy, and hepatosplenomegaly. So hepa it's the liver, and then spleno it's large liver with large spleen. So special attention should be given to patients undergoing chemotherapy, those with chronic disease, or those presenting with unexplained fatigue or infection. Here the in assessment for the nursing responsibilities include preparing patients for diagnostic tests, educating them on procedure, especially invasive ones like bone marrow biopsy, monitoring for post-procedure complication, and assessing lab values for signs of pathology. Special populations such as especially the elderly may slow decrease bone marrow reserve and immune function, which can alter labs interpretation. We know that with aging, the production of blood cells declines, making older adults more susceptible to anemia, infection, and impaired wound healing. Nutritional deficiencies and chronic diseases further affects hematological function in this population. We have like in history for the nutrition, we do like because we have to know the iron, the B12, folate intake, then past medical, we have the bleeding disorder, malignancies, liver, kidney disease. Medication is like anticoagulants, platelets, chemo, anti-epileptics. For the exposure, we have the radiation, toxin, and recent travel like for malaria. For physical assessment, we have like head-to-toe assessment. For skin, head, neck, and assessment, we have the skin, if it's pallor, jaundice, petechiae, ecchymosis. On the face, any conjunctival pallor, glow cities, when you talk more in anemia. And then for cardio and respiratory, we have tachycardia, orthostatic hypotension, like with anemia, musculoskeletal bone pain, like myeloma, leukemia. For abdominal, it's like enlarged spleen and enlarged liver, like splenomegaly and hepatomegaly. So not for meds predisposing to bleeding like the NSAIDs and steroids. The nursing responsibilities, we have the assessment, diagnostics, risk for bleeding, that's the focus, fatigue, artery tissue perfusion, planning, because it's add pi, so A, it's assessment, D, it's diagnostic, C, risk for bleeding, fatigue, P, P is for planning, so it's prevent falls, manage oxygen needs, monitor labs. Then we have implementation. We need to administer meds, blood products, dietary teaching. E for evaluation, increase energy, normal hemoglobin and hematocrit, no adverse effects. Also, we need to know about the early stages, like infants, early stages of life with rapid cells growth, more sensitive to toxic because of the fast cell diffusion. The toddlers have growth, it's continue, which developing immune system. They can be at risk for some childhood cancers. For the adolescents, we have hormonal changes influence cell growth, so higher leukemia incidence than in toddler. We have also for pregnant women, the hormonal shifts can impact cell regulation. We focus on limited treatment option if cancer occurs. Chapter also focus on older adults. Aging cells are more prone to mutation, higher cancer risk, comorbidities affects treatment, lifespans consideration. Again, this is like infants and children, nutrition, iron, pregnant women, higher iron needs. Older adults have chronic disease, which is slow marrow recovery.
We use the reticulocyte count to assess bone marrow response, while hemoglobin electrophoresis helps detect disorders like sickle cell and thalassemia.
We have the diagnostic studies. So the hematological diagnostics procedure is all about how we evaluate the blood function by looking at the red blood cells, white blood cells, platelets, and coagulation times. It converts various blood tests and bone marrow biopsies, which are very crucial for diagnostic blood disorders, infection, and even some cancer. In these chapters also details the nursing action involved before, during, and after those procedures, as well as potential complications like bleeding and infection. Diagnostic tests include the complex blood cell count, the CBC, here, and with differential reticulocyte count, peripheral blood smear, coagulation test, PT, INR, PTT, iron studies like ferritin, vitamin B12, and folate levels, and bone marrow biopsy. Each test offers critical information to determine the presence of type of hematologic disorders. So if we go next to examination of bone marrow, aspiration biopsy to detect thrombocytopenia, leukemias, anemias. Then we have preparation and nursing implication. So for the aspirations, it's for the cells, and the biopsy is to see what's going on. And this is from posterior iliac crest. Indication, it's unexplained cytopenias, melanoma, metastasis. And for nursing, it's consent from patient, prone and side laying, pre-medicate, maintain pressure dressing to the post procedure. And what else we have? Yeah, here are the most commonly testing areas for the NCLEX. So to understand the blood components and their normal ranges, coagulation studies, and then the bone marrow aspiration biopsy, how we do pre and post nursing action and potential complication are very important. Blood transfusion also, this is crucial area, covering types of transfusion compatibilities and especially the recognition and management of various transfusion reaction, acute hemolytic, febrile, allergic, bacterial, circulatory overload. For age-related changes, older adults and anemia. Here, so it's at the end of the chapter, which explains that while bone marrow ages, it produces fewer blood cells. You can see in the table 33.9. The bone marrow ability to produce the red blood cells and the white blood cells may decrease. The number of circulating red blood cells along with hemoglobin and hematocrit levels are reduced, and this may contribute to fatigue. Lymphocytes decrease in their number and ability to detect against bacteria, which reduce the ability to fight infection. While the human body ages, the number of cells of the body is gradually reduced. Lean body mass decreases, but fat tissues increases until approximately age of 60. The bone mass and intracellular fluids also tend to decrease, and normal aging causes a decrease in total body water. With a decrease in total body water, there is less fluid in the bloodstream. So blood volume decreases with lower levels of plasma proteins. The lower plasma protein level may be related to a low dietary intake of protein and reduced protein production by the older liver. So again, for elderly, it's decreased marrow cellularity and iron, increase in fragility of red blood cells membranes, and decrease in immune response, which is higher for anemia and infection risk. So the baseline of hemoglobin may decline slightly. The platelet function may also decrease. So let's get into the details of those important hematological diagnostic procedures, starting with blood components and their normal ranges. In this image, it says 39.1, but this is from ATI Med-Surg related to this chapter. And this is nice to have because it says here elevated, decrease, elevated, decrease, elevated, decrease. So just read towards. I kind explain through the chapter about the iron, but this is the normal level. We talk about this, we saw already this, we talk about the clotting factors. Yes, decreased time, vitamin K, excess, and then the dimer. So imagine that your blood as a bustling city full of different workers, each with a specific job. Those workers are your blood components, and knowing their normal population is key to understanding patient health. The red blood cells with erythrocytes, they are like the oxygen delivery trucks of your body. They carry oxygen from your lungs to your all tissues. We have the normal ranges for females and males, and why they are important. If you have too few, it's in anemia. Your body isn't getting enough oxygen. Too many, polycythemia, and your blood can become too thick. The white blood cells, those are your body immune defense team, fighting off infection and inflammation. We have the normal range between 5 and 10. Why they are important? A high count usually means infection or inflammation is brewing there, while low count can indicate a weakened immune system. Hemoglobin, this is a protein inside your red blood cell that actually binds to oxygen. Think of it as the cargo that the delivery truck carry. We have the normal ranges for females and males. Why is important? The low hemoglobin means less oxygen carrying capacity, directly impacting how well a patient tissue are oxygenated. Hematocrit, this means the percentage of red blood cells in your total blood volume. It gives us a quick idea of how thick or thin your blood is in terms of oxygen carrying cell. We have normal ranges for females 37 to 47%, males 42 to 52. Why is important? Low hematocrit often goes hand in hand with low hemoglobin and can point to anemia or blood loss. In surgery, you lose blood. High hematocrit can be seen in dehydration. The platelets, the thrombocytes, those are the teeny repair crew that help your blood clot and stop bleeding when you get a cut or injury. We have normal ranges, 150,000 to 400,000. Why are they important? Too few platelets? That means thrombocytopenia. You see again, penia, which is low, means a patient is a high risk for bleeding. Too many can lead to unwanted clotting. gets too thick. Think of it is this way. If a construction site, your body, needs to transport materials, oxygen, the number of delivery tracks, the red blood cells, the amount of cargo of each truck, hemoglobin, the total percentage of trucks on the road, hematocrit, and the availability of a repair crew for accidents, platelets, all need to be in good working order. So, quick review of learning outcomes for this chapter. As you see, let's get the highlight. So here it's from anatomy components. So let's do identifying key anatomical components of the hematological system. So here the hematological system includes the blood, the red blood cells, white blood cells, platelets, plasma, bone marrow, spleen, thymus, lymph nodes, and liver, which produces clot factors. Bone marrow is the primary site of hematopoiesis. The spleen filters blood, recycle old red blood cells, and storage platelets. Lymph nodes and thymus are involved in immune cell maturization. Example, the spleen removes the old erythrocytes and stores about one third of the body platelets. So if you have a quiz, which organ stores platelets and filters old red blood cells, the answer is spleen. Now we go to the 2 discussing oxygenation formation of hematological system. This means it's physiology. The red blood cells, erythrocytes, carry oxygen via hemoglobin. Oxygen binds to iron within hemoglobin, allowing efficient oxygen delivery to tissue. Erythropoiesis is stimulated by hypoxia and regulated by erythroprotein from the kidney. Example, an anemic patient may show fatigue and shortness of breath due to reduced oxygen carrying capacity. So quiz question might be, what stimulates erythroprotein release from the kidney? Answer is hypoxia. 3. Explaining the role of clotting cascade in maintaining hemostasis. Again, it's pathophysiology. The clotting cascade is a series of enzymic reactions that lead to fibrin clot formation. It includes the intrinsic and extrinsic pathway, which both covering, actually it's converging on the commune pathway, the factor 10 and 10A, the X and XA, resulting in conversion of thrombopene to thrombin, then fibrogen to fibrin. Platelets also form a plug, and clotting factors stabilize the clot. Example, a patient with hemophilia A has a deficiency in factor 8 and cannot form a stable clot. A quiz question, which protein converts fibrinogen to fibrin in clotting cascade? So the answer is thrombin. 4. Describing the procedure for completing a history and physical assessment of the hematological system. So here it says assessment, history and physical. So we remember that very detailed hematological history includes the fatigue, bleeding, bruising, recurrent infection, weight loss, diet, and family history. Physical exam checks for pallor, jaundice, petechiae, for the lymphadenopathy, also for the increased liver and enlarged spleen, and bleeding gums or nosebleed. Example, petechiae might be noted in a patient with thrombocytopenia. Penia means low. Which symptom? This can be a quiz question. Which symptoms is commonly found in patients with low platelet counts? So the answer is petechiae. In 5, we have correlating relevant diagnostic examination to hematological function. This is like diagnostic. It says diagnostic. In diagnostic, so common diagnostic include the CBC counts, which is the red and the white blood cells and platelets. Reticulocyte count is the bone marrow response. The PT-INR and the PTT, the clotting, iron studies, bone marrow biopsies, and hemoglobin electrophoresis for sickle cell or thalassemia. Those help diagnose anemia, clotting disorders, malignancies, and nutritional deficiencies. Example, a high reticulocyte count in anemia suggests bone marrow is compensating. A quiz question: which test assess the bone marrow's response to anemia? So the answer is reticulocyte count. On 6, we have explaining nursing consideration. Again, for diagnostic studies. Again, we are in diagnostics. Nurses must assess for bleeding before procedure, apply pressure post venipuncture, monitor for signs of infection or hemorrhage post bone marrow biopsy, ensure informed consent is obtained, and educate the patient on what to expect and when to report symptoms. Example, after a bone marrow biopsy, apply pressure for at least 5 minutes to prevent bleeding. A quiz question: what is priority action after bone marrow biopsy? Answer is apply film pressure to the site. The last we have discussing changes in hematological function associated with aging. So the same it's in diagnostic, but it's age related. Here we have aging decreased bone marrow reserve, reduces stem cell production, and affects immune response. Older adults may have lower hemoglobin levels, impaired immunity, and increased risk of anemia due to chronic disease or nutrition deficiency. Platelet function may also decline slightly. An example, imagine an elderly patient may have chronic anemia with no obvious bleeding due to reduced marrow activity. Now in a quiz question, what hematological change is commonly seen in adults, older adults? Answer is decreased bone marrow reserve. And here we are at the end of the chapter. I hope you like, you subscribe, and see you in the next one. Thank you again for your time and trust. I'm Marcia, and from my heart to yours. Until next time, stay zen, stay grounded. Namaste. Bye for now.